You know, every month we go to one of the different offices of Singing River Health System and meet one of their doctors and find out some of the great things, the great work that they're doing with Singing River Health System. Well, today on the show, we're talking to Dr. Nicole Walton, who is with, she's a rheumatologist with Singing River Health System. We're over here in Pascagoula. How are you?
I'm doing well. Thank you for
good.
having me on today.
Well, thank you very much for being here. You know, rheumatology, people wonder what all that is, and it's a lot more than just dealing with arthritis, and we're going to delve into that in just a minute. But first of all, give us a little talk and background about yourself.
Okay, sure. Yeah, so I'm actually a native of the Mississippi Gulf Coast. I grew up in Ocean Springs. After I graduated from high school, I went up to the University of Arkansas. That's where I did my undergrad. Left there and did medical school in Kansas City, Missouri. After I finished up med school, I did my residency at Medical College of Georgia, which is in Augusta. So I spent 3 years there doing internal medicine, and then I stayed on and did a 4th year as a chief resident. After I finished that, I went up to Winston-Salem, North Carolina, and did my 2-year rheumatology fellowship there. So I finished that up in 2013 and came here, and I've been working with Singing River since.
All right. It's a great organization to work for. I mean, all the doctors that I've talked to, you know, they really enjoy what they do and working with the people here on the Gulf Coast. As a rheumatologist, what exactly do you treat?
Right, so rheumatology is a specialty that is focused on autoimmune disease in particular. And what that means is basically that the body is attacking itself. And that can present in a lot of different ways. But yes, most commonly, I would say patients come here because of joint pain, swelling, stiffness, loss of mobility, you know, and these things are typically rather rapid onset, so they're going to happen pretty quickly. You know, I usually tell people that they know their bodies better than anybody else or any other lab or x-ray. So if something just doesn't feel right, it's not your norm and it lasts for more than a few days, you probably need to go see your primary care doctor, and then they may end up referring you to see us.
Now, and that's one of the key points that you mentioned, doctor, is that we know our bodies. And when there's something not quite right, and it does last a few days, there's nothing to fool around with, because with so many different things going on nowadays,
Right.
you know, you want to, you know, the sooner you catch it, the easier it is to be, you know, to treat it. To
be proactive, yes, definitely. With autoimmune disease, early diagnosis is key. We have figured that out through years and years of, you know, studies and data, that if we can diagnose early and start treatment early, in many cases, you can prevent joint damage from ever happening, and protect people's independence and ability to stay active and mobile for as long as possible, which is really, really important. And
I was reading at some of the common conditions of rheumatology: inflammatory arthritis, rheumatoid arthritis, of course, psoriatic arthritis, I hope I'm pronouncing these right,
ankylosing spondylitis.
That one.
That one.
Lupus, scleroderma, gout.
Yes.
And connective tissue disease.
Right. Scleroderma, mixed connective tissue disease, Sjogren's, those kinds of things. So, like I said, most of our diseases are going to be systemic inflammatory diseases. You know, you may feel it just in your joints, but you can actually have the disease, like rheumatoid, for instance, is a inflammatory disease process that most people feel in their joints, like in their fingers and their toes. But you can actually have rheumatoid arthritis in your lung. You can have it in your eye. So they're systemic inflammatory disease processes, which is part of the reason it's so important to come and see us, so we can try to figure out how all is it affecting you, and then we can decide what is the best, safest treatment for that condition.
So let's say I'm a patient, I come to you my first visit.
Right.
What do we do?
So the first visit is mostly going to be spent just obtaining history. I'm going to talk to you about your symptoms, how long they've been going on, what exactly you're feeling, and then I'm going to do a really good physical exam, looking at your skin, joints, muscles, just kind of trying to find any clues as to what may be going on. We may order blood work or x-rays, just to try to kind of focus in a little bit on what's bothering you, and then our follow-up appointment is pretty quick after that, where we're going to go over all those results, discuss, you know, what I believe is the problem, and then how we're going to move from there with treatment.
Now, all the different doctors that I've interviewed here with Singing River Health System, you know, they talk about the importance of health screening. I mean, it doesn't matter which field that they work in, but the importance of getting early health screenings. What about bone density?
Right, so preventative care is a big deal. This is something that we try to catch a problem before it becomes a problem. So in our world, yes, the bone density screening test is very important with autoimmune disease in particular, because we do have to use a lot of steroids to treat autoimmune disease. And steroids can weaken your bones, so we will typically screen our patients for that problem because we want to know if there's an issue there before we ever put you on that kind of treatment, so we can protect your bones. Most people are going to get a bone density test. If you're a woman, it's going to be at 65 years or older. And if you're a man, it's going to be 70 years or older. But if you're younger than that and have risk factors, including things like rheumatoid arthritis, we may even screen sooner than that.
Okay. Now, and I was reading you use bone density testing for several different things.
Right. So
confirming the diagnosis of osteoporosis.
Right. So bone density test is like getting an X-ray. It's non-invasive. It's safe. It's pretty affordable test. And it basically just tries to help us get an idea of the integrity of your bone. It's not going to show us anything with arthritis per se, but it's like if you took one of our long bones and you kind of looked at the inside of the bone, it shows us how strong or weak the bone is. So it's an assessment for your risk for fracturing.
Okay. Now, you're talking about women 65 years or older,
right.
Men 70 years or older. Do you ever have any issues with younger people getting arthritis at an early age and that you have to treat them?
Oh yes, we do. So autoimmune disease does typically affect younger women in particular. We see both women and men, but most commonly in autoimmune disease is like rheumatoid, for instance, is going to be this young middle-aged female. That's our, most common probably age group.
And I guess maybe they don't follow proper nutritional values. I mean, that's one of the important things too. Proper nutrition or improper nutrition, can that contribute to
well, I think healthy living
problems?
and lifestyle is just really important. I really try to stress how important it is to focus on not just treatments, but we also want to focus on lifestyle, and that includes all kinds of things like proper nutrition, of course, but then getting the proper amount of sleep, making sure you're exercising on a regular basis, trying to manage stress levels really well. So all of that's very important in keeping your body in, I believe, the healthiest kind of state that it can be.
Well, I know you have 3 locations, Biloxi, Ocean Springs, and Pascagoula. So what you need to do, of course, is to, call your primary physician and they will definitely make a referral to you here at
So primary care is
System.
your first stop. Do another good kind of exam, start some screener labs, and then they'll decide if it's appropriate to see us or not. And actually, we're seeing people in Gulfport now too. My partner, Dr. Carroll, goes to Gulfport, and then we have Biloxi, Ocean Springs, and Pascagoula.
Dr. Walton, thank you very much.
Thank you so much.